Meet Emiliano. He's 55, 8 days out from a total knee replacement, mostly confined to the couch. This morning, without warning, he suddenly couldn't breathe. Before naming a diagnosis, notice the pattern. Emiliano has abrupt shortness of breath at rest, rapid breathing, a fast heart rate, chest discomfort, and restlessness. His oxygen level barely improves with oxygen. That tells us the problem isn't simply getting oxygen into the lungs. Something is stopping blood from using that oxygen. In a recent post-operative immobile patient, this should immediately raise concern for pulmonary embolism. A D-dimer may be elevated, but the definitive test is a chest CT with contrast. If contrast can't be used, a VQ scan compares airflow to blood flow to find a mismatch. Now, interpret what's happening. Emiliano has a pulmonary embolism, almost certainly from a clot that formed in the deep veins of his operated leg and traveled to his lungs. The clot lodges in a pulmonary artery and creates a ventilation-perfusion mismatch. Air reaches the alveoli, but blood does not. Gas exchange fails, oxygen levels fall, and alveoli lose perfusion and collapse. At the same time, pulmonary vascular resistance rises abruptly. The right ventricle, built for a low-pressure system, suddenly has to pump against a blocked circuit. It strains, dilates, and can fail. That acute right-sided heart strain, not hypoxia alone, is what kills patients. Why Emiliano? Virchow's triad predicts it: vessel injury from surgery, venous stasis from immobility, and a hypercoagulable or tendency to clot state. He hit all three. Now respond. Start anticoagulation with intravenous heparin. Heparin does not dissolve the clot. Instead, it prevents extension and new clot formation while the body breaks it down over time. Monitor the APTT and watch for heparin-induced thrombocytopenia. Once stable, transition to oral anticoagulation for at least 3 months. Provide supportive care with oxygen, continuous telemetry, bleeding surveillance, and ultrasound evaluation for deep vein thrombosis. If Emiliano is unstable, escalate rapidly to thrombolysis with clot-busting drugs, catheter-based thrombectomy, or surgical embolectomy. Finally, reflect. If he improves, oxygenation rises, heart rate slows, and breathing eases. If he worsens, he risks sudden cardiac arrest. In summary, a pulmonary embolism blocks a pulmonary artery, impairs gas exchange, and acutely strains the right heart. Think sudden dyspnea, confirm with a chest CT with contrast, and treat immediately with anticoagulation. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.